Welcome to Pathopulse_Radhika. So the question for today is a 38-year-old male with history of IV drug abuse was suffering from chronic hepatitis. Given below is a picture of a liver biopsy. Which of the following hepatotropic virus could be the probable etiology in causing this liver disease? So here you have various clues. So one of the important clue, the patient is a IV drug abuser. So you have to understand which virus spreads by IV route, okay, or parenteral route. Okay, certain virus can spread by a parenteral mode, okay, that's the route of transmission. Certain virus can spread through fecal-oral transmission. So this is one of the clue, and the next clue is the liver biopsy. So what is this liver biopsy showing here? So in the liver you have some lymphoid aggregate. So all these blue ones are lymphocytes. Near the portal tract you have your lymphoid aggregate. So these are your clues. So with this background, what can you diagnose? So when you take the hepatitis groups of viruses, you have hepatitis A, B, C, D and E. So each of them have certain important characters. Okay. So hepatitis B is a double-stranded DNA virus, whereas the rest are all a RNA virus, single-stranded RNA virus. So that is important. So apart from that, each one of them has got a specific mode of transmission and certain specific features. So hepatitis A, remember A for A usually causes acute hepatitis, whereas B and C are involved in the causation of a chronic hepatitis, and C is one of the most common cause for chronic hepatitis, right? So this you should remember. So one more thing which you can remember is this hepatitis D. It's called replication defective virus. They can't replicate by themselves. They require help of other virus, usually a co-infection or a super infection with hepatitis B. And the most important point about hepatitis E is if it happens in pregnancy, it's got a very bad prognosis. So that you should remember. Hepatitis E during pregnancy is really a serious thing, right? So I'll just summarize whatever I have told. So except for hepatitis B, which is a double-stranded DNA virus, the rest are all single-stranded RNA virus. A is usually an acute infection. B and C can cause chronic infection, though it can also cause acute hepatitis. D for D, defective. Hepatitis D is replication defective. It occurs as a co-infection or super infection with hepatitis B, and hepatitis E has got a worse prognosis during pregnancy. So this is certain points to remember about all these. And B and C can spread through your parenteral route, through your sexual transmission or during blood transfusion, or sometimes from the mother to the fetus, whereas hepatitis A spreads through fecal-oral route. Okay, so this is one of the commonest thing which you should know. Then coming to biopsy as such, you have certain important things. So whenever you see a lymphoid aggregate, of course you go for certain serum tests, but lymphoid aggregates can be seen in many conditions. But when you think about specific hepatitis virus which can cause lymphoid aggregate, it's hepatitis C which can cause your periportal lymphoid aggregate. So apart from this, what you should remember is you can have lymphoid aggregate. Apart from this, you can have some steatosis. So fatty change can be seen in case of hepatitis C, and sometimes you can have a focal bile duct injury also in case of chronic hepatitis C infection. So all of you must have known about the appearance of hepatitis B in histology, but hepatitis C, remember these 3 points. You can get a lymphoid aggregate, steatosis or focal bile duct injury. So what is this? So this is how when you have infection by hepatitis B, so this is a typical appearance. The hepatocytes look like this. So what happens in chronic hepatitis B infection? You have something called ground glass appearance. So the ground glass appearance is seen in hepatitis B infection because their endoplasmic reticulum will have all the hepatitis B antigen, surface antigen. Okay, so this can be highlighted by immunohistochemistry for hepatitis B antigen, or sometimes Orsin stain can also highlight these hepatitis B surface antigen. So these are few important points to know about chronic hepatitis. Thank you.